Welcome everybody to the June installment of our virtual CW Classics presented by Kaiser Permanente. CW Classics provides monthly health and wellness activities to Santa Cruz County residents. My name is Joe Foster and I'm the Public Affairs Manager for Kaiser Permanente here in Santa Cruz County. Today I'm here with Kaiser Permanente dermatologist Dr. Amara Lieberman, and we're going to discuss sun safety and precautions we can take to protect our skin from the sun this summer. So Dr. Lieberman, thank you so much for being here with us today. We really appreciate you participating in the CW Classics for June 2021. We have a list of questions here that I think everybody watching and listening will be really interested to hear the answers to. But before we get to that, can maybe start off with a little insight on your background and your practice here at Kaiser Permanente?
Sure. So again, my name is Amara Lieberman. I'm the dermatologist for our Santa Cruz County members. I joined Kaiser in 2018, but I've been practicing dermatology for many years before that. I am board certified by the American Board of Dermatology and a long-term member of the American Academy of Dermatology. My practice here is to take care of all skin concerns and problems for our members. We do minor surgeries, treat rashes, screen for skin cancer as some of our more common practices.
Great. Well, like I said, thank you. We really appreciate you joining us. And I think this is the second year that we've done a sun safety type program through CW Classics. And you know, with great weather happening outside and people getting outside, now is a great time to talk about sun safety and what we all can do to stay safe and protect our skin. So with that, Dr. Lieberman, what does the sun actually do to our skin?
Right, so the skin has beneficial effects to the skin as well as detrimental effects. So the beneficial effects are that it gives us the vitamin D that our body needs for a lot of functions. Mm-hmm. It also has an anti-inflammatory effect on the skin, so conditions like psoriasis and eczema can do well with some sun exposure. But what we're mostly going to focus on today is the detrimental effects, and that is ultraviolet damage to our skin, which can lead to skin cancers.
So with that in mind, is everyone at risk, or what do some people need to be, or certain people need to be more cautious than others? And maybe you can elaborate a little bit on that.
Sure. So I think the answer to that is that everyone is at risk for skin cancer. However, that we all have our sort of individual sensitivity to the sun or ultraviolet damage. So lighter skin types can have a greater sensitivity and more likely to sunburn, and therefore are at increased risk of skin cancers. Mm-hmm. And people with deeper skin tones have more melanin in the skin, which is protective against ultraviolet damage, and therefore are less likely to get skin cancer, but does not mean that they cannot get skin cancer.
Okay. So, and basically, everybody is at risk to a certain degree. And everybody should be practicing some sort of skin care from the sun when they're out playing or at the pool or beach.
Correct.
Or whatever.
Yeah.
So speaking of that, we kind of planned this out to where it would flow really well, right?
Mm-hmm.
So whenever my family and I were getting our stuff together for the beach, we opened up our beach bag and we've got a bunch of different types of sunscreen in there. Relatively speaking, what is the best type of sunscreen, or is there a best type of sunscreen?
Right, so the type that we generally recommend that people to look for are the type that includes SPF, which stands for sun protection factor, that it should be at least 30, it should be water resistant, and it should be broad spectrum. But I will say most of the sunscreens that are on the market today do fit those requirements. The two main differences between sunscreens are those that use chemical sunscreens and those that use mineral sunscreens. There are some sunscreens that combine the two, but they work differently. The mineral sunscreens block the sun and reflect it off our skin, and the chemical sunscreens inactivate the ultraviolet light, but they become less active in sun exposure. So In terms of protection, I think the mineral sunscreens are better adapted at doing that. They're also friendlier to the natural marine life that if we are going into the bay or ocean with sunscreens on.
Right. It's amazing the number of options that we have now. Not, what they're based from, but also, the brands and everything. And, everybody used to think maybe sunscreen is sunscreen, but there's obviously options and things that you can look at and things you can take into consideration when selecting sunscreen.
Right. I always remind my patients that any sunscreen has to list the active ingredients on the back. So it's easy, so I don't necessarily recommend a particular brand, but you can look at any brand that you're interested in and flip it over and read the active ingredients, and you'll be able to see whether it has zinc oxide or titanium dioxide, which are the mineral sunscreens, or the chemical sunscreens, for example, avobenzone.
Okay, interesting, yeah. In addition to sunscreen, I think, sometimes I think like, gosh, if I put sunscreen on, fine, I don't have to worry about anything else. But is there anything in addition to sunscreen that we can do when we're out, when we're enjoying the park or the beach or whatever, that to help protect as well?
Sure. So I'm a big fan for sun protection other than just sunscreen. So that includes hats, sunglasses, and clothing. So in the area we live in Santa Cruz County, if people are out at the water, if you're wearing a wetsuit, certainly that's very protective.
Right.
Rash guard shirts, wide-brimmed hats, sunglasses. For people who hike, they have arm covers. They even have gloves I see at outdoor shops that are for sun protection, so they're not hot, and they can be worn to protect against the sun. So a combination of sunscreens and these items, personal items, will give you a lot of protection in combination.
Okay. Yeah, so it really is sort of a, holistic type approach to it.
Correct.
Not one magic bullet here or something that's going to do the trick. Overall, it really works better to have a whole suite of things that you're utilizing.
Right.
Great. Well, you mentioned earlier, Dr. Lieberman, about the health benefits of the sun too. What about vitamin D, and what should we think of regarding that?
Sure.
I'd love to hear your insights on that.
Right. So that is the sort of the flip side of being cautious with sun exposure, is that our body does require ultraviolet light to convert our natural vitamin D to the active form. So if we're being careful with sun exposure, we can have lower vitamin D levels. So I usually recommend that people supplement with vitamin D 1,000 to 2,000 international units daily. It can either be as a supplement, or you can get it through your diet, such as oily fish, meat, eggs, spinach. They have vitamin D, and fortified cereals, milk, if people drink cow's milk.
Okay, so a lot of different sources that maybe you're already part of your diet, but things that you can easily add in,
right?
Rather than having to take a supplement, or maybe in addition to the supplement.
Right.
Okay. Well, so kind of moving into the clinical setting here, I'm curious about when you have a patient that comes in and maybe they have pre-skin cancers or something that they're concerned about, kind of what happens there, what does it mean for their overall health, and what should they do initially?
Okay. So yeah, pre-skin cancers, also we refer to them medically as actinic keratosis. And actinic means that it's sun-related or due to the sun. And these are the rough, sometimes pink patches that are mostly felt, if not seen, on the skin in sun-exposed areas like the top of the scalp in men, face, chest, forearms, and the back of the hands. They kind of feel gritty. Sometimes they're interpreted as just dry skin, but they really are a direct result of too much sun. And they are considered pre-skin cancers because they can evolve into the type of skin cancer, which we'll talk about in a minute, called squamous cell. Okay. And those are indicators that you've had too much sun. They can be treated before they become skin cancers. They're usually treated with liquid nitrogen in the office, which often people refer to as being burned off.
Okay.
And then the other treatment is a topical chemotherapy cream that we prescribe.
Okay. Okay. So you mentioned squamous cell. We're talking about kind of like the initial screening, kind of initially what you would see. What are the types of skin cancers? Just what do people need to be educated about for their, kind of their edification and their knowledge going forward?
Right. So there are three main types of skin cancers. The basal cell type skin cancer, squamous cell, and melanoma. So again, going back to pre-skin cancers and squamous cell carcinoma, the one thing I wanted to mention is my colleagues at Kaiser Dermatology published a paper recently looking at a number of patients over a 10-year period to see whether having pre-skin cancers did truly increase one's risk of skin cancer. And this article was featured in the New York Times Science section last week, and because it did show that there was a 7 to 8 times greater risk of developing a skin cancer with these pre-skin cancers.
Okay.
So back again to the types of skin cancer, those can evolve into squamous cell, but the most common form of skin cancer is basal cell skin cancer. The American Academy of Dermatology predicts that 1 in 5 human beings during their lifetime will get basal cell, so they're very common. The good news is they don't do internal harm. We treat them because they will continue to grow, but they're generally, even though we know they're a direct result of sudden, they tend not to spread or cause internal harm.
Okay.
So the second most common type are the squamous cell skin cancers, and they also are directly from sun damage. A small percentage of them can spread and cause internal harm, but the vast majority of them can also be treated either surgically or sometimes with laser or other modalities. And then the more concerning skin cancer is melanoma, and that is the type that is potentially deadly form. They usually arise either from a pre-existing benign mole that's evolving into a melanoma, or they can arise as a new growth. So those are the ones that, if they're caught early, they're not a concern. If they have been around or allowed to grow long enough and spread, then that is when they can be potentially deadly.
And I would ask a quick follow-up question about catching it early. It depends upon the patient. It depends upon the person as far as how early on or how late, as far as catching it goes.
So yeah, that sort of leads into or segues us into what can one do.
Exactly.
To prevent these or to catch these early. Right. And actually it's been shown that most melanomas in particular are discovered by the patient or a family member of the patient as opposed to coming in for skin screens. So there's really a place for both. I highly recommend and think that everyone can learn how to perform their own screening. Right. Either using 2 mirrors, which we can sort of demonstrate a visual of that, also, or by enlisting a family member to help to look on the back of our bodies that we can't see. And so what I tell my patients to look for are lesions or growths that are changing quickly, or ones that look different than anything else on your body that we refer to as the ugly duckling.
Yeah, so it really is an ongoing thing that you have as part of your life, as part of your routine.
Right. I usually recommend that, 1 to 2 times per year. It's easy enough to do that, and some people can use their birthday as a reminder, whatever it is to remind us to do that.
Right.
And if you find anything unusual or concerning, you can point it out to your doctor.
Speaking of that, I was wondering, you're doing your self-examination at home, you're monitoring, if you need to monitor certain spots, but how often should you check in with your physician and even just for a routine appointment?
Yeah.
Just in general.
So I think that as, depending on the age population, but I'd say anyone from the age of 40 and up should consider, asking, it can be your primary doctor to ask your doctor to check your moles. At Kaiser, the primary doctors do the initial skin screens, and if they see anything of concern, the patient will be referred to dermatology.
And no matter the skin tone, I mean,
Correct.
If you're tanner
Correct.
skin or lighter skin.
Right.
Yeah, it's all the same. Just
Yeah.
as we were saying at the beginning, that everyone is at risk. Everyone needs to be mindful, and everybody needs to practice good, safe, sun safety type measures to ensure that they're healthy and thriving going forward.
Right.
Okay. Well, thank you so much. Curious, any other takeaway messages for our listeners out there?
Well, I think the important takeaway messages are to, practice sun safety as we discussed, like using sunscreen, clothing, hats, and sunglasses. It also helps, that I didn't mention earlier, but the time of day in which we're in the sun. So if you can put your outdoor activities earlier in the morning, later in the afternoon, you're also protecting your skin somewhat by doing that. I think another take-home message is that although skin cancers are common and are potentially frightening, that the vast majority of them are treatable. And then the last take-home message is to perform self-skin exams and to ask your doctor to look at anything that looks suspicious. And I'd like to end with actually recommending that if anyone has further questions or interest in what we talked about today, that the American Academy of Dermatology is an excellent resource for any questions about skin, whether it's sun damage or other skin conditions, and they can be accessed by their website at AAD for American Academy of Dermatology.com. And it's a lot of patients find that to be a very helpful website.
Great. Thank you. Thank you so much, Dr. Lieberman, for joining us today,
You're welcome.
sharing your insight and giving us a whole host of information to take forward with us during the summer as we're getting outside and enjoying beautiful weather today. Sometimes we get the fog rolling in, but you can still get out and enjoy it. And I know even with fog, you still need to be
Correct.
mindful of skin care and practice sun safety. So thank you all for joining us today for our June 2021 CW Classics event, brought to you by Kaiser Permanente and the Santa Cruz Warriors. For more information about our monthly CW Classics, which happens the last Monday of each month, visit santacruzbasketball.com/classics. And thank you and have a great day.
Thank you.